Hello, my name is Evelyn Ndinda. I'm an obstetrician gynecologist and privileged to be among the few Kenyan doctors trained as Hifu specialists. So welcome. Today I'll be taking you through what Hifu is, and we will take a tour at the site, and I'll be able to show you the machine and part of how it functions. So feel welcomed. So what is Hifu? Hifu is an abbreviation for high intensity focused ultrasound, and this means that the technology does not use any radiation or any X-ray waves. It is completely safe. You'll even be able to see that our treatment center does not have any precautions similar to what you would find in an X-ray room or even in a CT scan room. So Hifu is a technology that has existed for more than the past 20 years. It originated from China, and the technology has been adopted all the way around the world. And now in Africa, we are the newest facility. Tanzania onboarded last year. There is also Nigeria, which has existed for a while. There is Cairo, Egypt, and a few other sites that are coming up. So we are privileged to be the newest site and to be able to offer this amazing technology to our women. So who qualifies to undergo Hifu? Currently, we are focusing on benign conditions, and this is uterine fibroids and adenomyosis. In the future, we look forward to expanding the target population similar to what the other countries are doing, to include patients who have solid tumors, whether benign or malignant, that is cancer. So right now we've been able to treat more than 20 patients, and we are privileged to announce that they have all had good outcomes. We do not take that for granted, and it also stands to show you how beneficial this technology is. The facility opened in February, and between February to now, we're literally talking about just 4 months, under 4 months. And so far, women are embracing the technology, they are seeing the benefits, and we are here as your doctors to serve you. So why is Hifu a good option for you as a woman with uterine fibroids or adenomyosis? So compared to conventional methods or medical management and conventional surgeries, Hifu is a non-invasive procedure, and this means there is no cut. There is a short stay within the facility. Most of our clients are able to come in the morning, undergo the treatment, and by evening we are able to discharge them. Also, the time you need off work is very short, within 5 to 7 days. As long as there are no other complications, you are able to resume your work, especially if you do not do a lot of labor, any work that is labor intense. In terms of future fertility, because there is no interference with the blood supply to the ovaries, to the uterus, there's no cut we're making, fertility is highly preserved. And unlike open myomectomy or even a laparoscopic myomectomy, where future deliveries are recommended to be done via cesarean delivery, Hifu does not interfere with that, and a woman can actually undergo vaginal delivery, of course, unless there are other obstetric recommendations. So right now I want to take you to our procedure room. So come with me. I'll show you what the machine looks like and how the unit looks like. So you can see right from the doors, these are normal glass doors. There is no precaution of radiation, similar to what you would find in an X-ray room or in a CT scan room. So come and see how the procedure room itself looks like. So this is our machine. You can see most of our clients think it's an MRI, but it is just the technology and everything that is needed. So right here we have the control panel where we are able to see everything. We have the ultrasound machine. For most women, I'm sure you've seen this. If you've been able to visit your gynecologist or obstetrician, it's similar to what you would have even when you're pregnant. So this tells you there is no radiation. It is purely an ultrasound based technology. Then on this side, this is where the patient lies during the procedure. And if you come closer, you'll be able to see that the probe on the inside is just an ultrasound probe. We have the transducer, which is what allows us to enhance the energy and reach levels that produce heat to about 60 to 100 degrees Celsius. And this is what allows us to burn or ablate the fibroids, and the body is able to take care of any further shrinkage over time. So the patient lies here for about 2 to 4 hours. Of course, this depends on the number of fibroids, the size of the fibroids, and the blood supply to the fibroids. And that's why we are able to see the patients before booking them for the surgery. We are able to do a number of tests, including an MRI, so that by the time we are scheduling you for the procedure, we've done all the necessary precautions and we've prepared well for the procedure itself. On the other side, we have a recovery unit where our patient lies or recovers for about 2 hours. And after that, we are glad to offer a bowl of soup before the patient proceeds home. So as you can see, this is a day facility similar to what you would find in any other minor theatre or where day procedures are carried out. So I welcome you, Kenyan women, and any other woman who has been suffering from fibroids and has been scared of surgery, or even has had recurrent surgery and is now looking for a new innovation, a new technology that does not include surgery. And I want to leave you with a quote from Sir William Osler: "The diseases that cause harm to the patients require treatment that causes less harm." Karibuni to Hifu.